October and Beyond is our annual webinar series. It used to be a one-day in-person event, but it's transitioned to be online and spread out from the end of October and into November. Our focus in this webinar series is on occupational disease prevention and discussing different things that the Ministry of Labour, Immigration, Training and Skills Development and the Health and Safety System partners, including OCAL, have been up to for the year. So I'm Krista Thompson. I'm an occupational hygienist with OCAL. What I will do now is I'm going to turn it over to Caitlin Witka, who's also with OCAL, just to do a land acknowledgement.
Thank you, Krista. Good morning, everyone. So we will begin the October and Beyond webinar series by acknowledging that the work of occupational health clinics for Ontario workers takes place on traditional Indigenous territories across the province. We acknowledge that there are 46 treaties and other agreements that cover the territory now referred to as Ontario by settlers. We are thankful to be able to work and live in these territories and to the First Nations, Métis, and Inuit people who have cared for these territories since time immemorial and who continue to contribute to the strength of communities across the province. It is important to note Indigenous workers are often vulnerable workers and face discrimination in the workplace. They are more likely to live near contaminated sites and thus work on job sites that are contaminated. OCAL encourages all to educate themselves and take concrete steps towards truth and reconciliation in their own spheres. Thank you, miigwech.
Thank you. I'm going to turn this over to Kimberly O'Connell, also with OCAL, an Executive Director. Before I do that, I'll just let you know who Kimberly is Executive Director and past co-chair of the Occupational Illness Prevention Steering Committee, which is an Ontario Health and Safety System collaboration within the Ministry of Labour, Training, Immigration and Skills Development. Kimberly received her Master's of Science applied in Occupational Health, specializing in industrial hygiene from McGill University. She is a certified industrial hygienist, a registered occupational hygienist, and a Canadian registered safety professional. Kimberly also has a broad and in-depth technical knowledge of health, safety, and environmental issues with a focus on primary prevention of occupational diseases. With over 25 years of experience in occupational health and safety and a strong belief in collaboration and teamwork, her passion prevention, which stems from the loss of a close family member to a workplace fatality in 1993, is infectious. So I'm going to turn this over to Kimberly.
Great, thanks, Krista. And we were hoping for some welcoming words from Dr. Joel Moody. Dr. Moody, have you joined us? Welcome. So I'm so glad to see you. And Dr. Moody was appointed as our Chief Prevention Officer and has been spearheading this initiative around occupational illness prevention, among many other strategic initiatives. Dr. Moody was appointed in September of 2021. How time flies. Prior to this, he was the Chief Public Safety Officer and Senior Director Analytics at the Electrical Safety Authority, and has over 17 years of experience working in various labor organizations throughout our province. Dr. Moody leads the Prevention Division and is responsible for the oversight of the occupational health and safety prevention system. He provides advice to the Minister on the prevention of workplace injuries and occupational diseases, and on any proposed changes to the funding and delivery of services for the prevention of workplace injury and occupational disease. He works with the WSIB and the health and safety associations, including ourselves and related stakeholders, to advance the transformation of occupational health safety system in an evidence-based and outcome-focused model to eliminate workplace injuries, fatalities, and illnesses in Ontario. Throughout his career, Dr. Moody has championed innovative approaches to harm reduction and regulatory oversight. He's well known throughout the health and safety sector for his ability to build and maintain strong relationships with stakeholders, as well as his passion for worker health and safety. Equity, diversity, and inclusion are also central to his philosophy and leadership. Dr. Moody holds an executive education certification in strategic management of regulator and enforcement agencies program from Harvard University, a doctor of medicine, and a master of, he has so many credentials. I apologize. A doctor of medicine and advanced certificate in epidemiology and biostatistics from George Washington University, a Master of Public Health, International Health and Epidemiology from the University of Alabama at Birmingham, and a Bachelor of Science in Engineering, Civil Environmental from Duke. Thank you for joining us, Dr. Moody. Oh, we might not hear you. Nope.
Can you hear me now?
We can. Thank you. No, we
Testing
did.
1, 2.
Yes.
Can you hear me?
Yes.
Okay, thank you. Apologies. When technology works, it's great, but it's also one of those things that when it's not working, people will quickly let you know. So thank you, Kim. I was just saying I'll have to work with my team to kind of shorten those words because at the end of the day, I just was able to go to school for a long time. But what it also encompasses is just, highlighting the importance of all of us bringing our skill sets to what we're trying to do. And that's where I want to say thank you very much for letting me come and kind of open up again for October, your October learning series. Fitting, today is All Hallows Eve or Halloween, an amazing time of year. I've had a chance to talk with the attendees in years past. As you said, 3 years, it goes by fairly quickly. But end of the day, we're moving in positive directions. The system is rallying, and our workers at the end of the day are having better access to information, better access to training, and we're going to be improving outcomes. And that's the entire reason of why we meet. So I want to say, Kim, thank you, and to the rest of OCal for letting me come and just share a few words today. Had a chance to look at kind of the agenda of what's going to be happening throughout the month. We have some great people that are going to be speaking. And I think it's one of those things within Ontario, the health and care system, the health and safety associations, OCal or Worker Center, hidden jewels within our system. Because the work that you do not only provides great impact within Ontario, but it's also viewed around North America. It's also viewed around the world as some of the leading and cutting edge knowledge, research, translation of knowledge that exists. And we have you here in the province. So looking forward to some of the sessions that are coming up. When we talk about some of the research that's happening, silica exposure, kind of number 2 on the list of exposures from an occupational standpoint. Want to find ways to better measure exposure such that we can better management. And I know that that's some work that's happening across the system. Just yesterday, I think you and some of your team were talking with some of our training providers here in Ontario, Kim, and the amount of discussion that's coming up saying, how can we learn more? How can we assist with spreading that knowledge and access? So important. Because when we talk about disseminating, work throughout the system, is working with our partners, both traditional and non-traditional, that we're going to continue to make strides and efforts. And so, as you know, the work around occupational illness, it is an area of focus within the prevention work strategy that is here in Ontario. We're 2.5 years into the prevention work strategy, and it's very clear. Not only are we going to be looking for better data, better system connections, small business, roles and regulations, but we're also looking around occupational illness. And why is that? Well, if you know about me, you say a little about epidemiology, I want to really kind of put it into perspective. Because when we highlight the importance of this issue, in 2022, about 40,000 allowed occupational disease claims in the province. This amounted to over $82 million in costs. And those are direct costs. But what about the additional costs to families? What about the additional costs to their communities? What about the additional costs to society? So we know that we can find ways, because these are lives, these are individuals that we are here to help support and to prevent these illnesses and diseases from happening. Because we also know that in 2022, we had unfortunately 146 occupational fatalities that were related right now. But that only scratches the surface. So the work needs to happen. It has to continue. And so that's by working together, funding the research, ensuring that we're also looking at compliance and enforcement about substances that we know are hazardous to individuals. We as a system, we're continuing to do better because I know that we can. Work needs to continue and it's happening. So what are we doing? Well, once again, the tools at OCal you're developing, not only for silica, but heat stress, other aspects around to help guide, to help inform, so important. The work that we are doing here with the ministry upon occupational registries and exposures to different aspects. And you mentioned the work that was done with our colleagues at the MAP Center at St. Mike's, leading ways by which we're going to transform the system for the better. What I've been hearing when I came on, there are a lot of things that we've been wanting to do. Well, we're doing them now. So the first time we're actually looking at the occupational illness system from basic prevention all the way through the health and safety systems, all the way through the public healthcare system. And what are the places that need to truly be engaged to make transformative evolution with better prevention services of occupational illness and diseases. So exciting time. I could go on and on because I get super excited because I am passionate about this. I'm an oncologist by training. And so I've seen by which when we haven't had the best ways to manage exposures, I didn't want you to come and see me. So how might we find ways? And so everyone, our workers, our employers, our health professionals, joint health and safety committees. So all of you, thank you for turning in and tuning in to our sessions today. And I hope that you continue to learn and listen, but equally as importantly, collaborate with each other and share information, share your stories, because that is how we're going to continue to make Ontario the best place to live and work. And so thank you so much for having me and enjoy the rest of your afternoon. Thanks, Kim.
Thank you so much, Dr. Moody. Holly, are you able to share your screen? Wonderful. So just picking up on where Dr. Moody led and leads us to and continues to lead us, I'm just going to go into a little more detail on some of the occupational illness prevention priorities in Ontario. And really, as I said to Dr. Kirkham, who's coming up next, just a longer introduction to her session. And we do have the whole silica control tool team here today. We'll be ending today's session in a panel discussion. And you might see that we are dressed for Halloween through our backgrounds, which are silica containing materials that you see in various areas of the province. So there you go. We're on theme today. So yeah, I'm just going to go into some of the occupational illness prevention priorities, and you can move to the next slide, Holly. Some of you, it's been a repeat. If you attended our, some hygienists attended our Occupational Hygiene Association meeting, and Tracy and I both spoke there on a similar subject matter. We are trying to spread this information wherever we can. So really the occupational illness focus in the prevention work strategy that Dr. Moody's leading out is part of the strategic plan released in July of 2021. And although the ministry, as he mentioned, provides funding, the Auditor General report to all the health and safety associations, they're really working hard on figuring out how these associations, including ourselves, have been helping to prevent occupational injury and disease and measuring impact. And so some of the things supporting that I've been involved with and continue to be involved with are the former ODAP, or the former Occupational Disease Action Plan, that also was recommended to continue by the Auditor General, and has since turned into the Occupational Illness Prevention Steering Committee, which the projects, as Dr. Moody, for that steering committee this year were both the Ontario Silica Control Tool and a heat stress toolkit, which was developed to update all of the OSHCO materials. And these were both collaborative, collective impact partnerships with all the OHS system partners. And also I sit at the Occupational Illness Leadership Table, which is the expanding those partnerships into public health and the healthcare system. As Dr. Moody said, as an oncologist, he wasn't as happy to see his visits. And this initiative is going to work on with the clinical lens across ministries to try and collaborate through multidisciplinary, evidence-informed approaches across even broader systems to try and prevent occupational illness, breaching both the labor and the health ministries and environment as well. Prevention works, the strategy that Dr. Moody spoke about. Maybe we can go to the next slide as well. Just summarizing for you, we had some strategic review meetings, and it was mentioned that this area of system focus is not in fact a separate pillar, but it is the root of all of these objectives, both work-related mental health and workplace violence and harassment, and occupational illness should be seeped throughout each of the objectives. And we feel that the Silica Control Tool project through that steering committee and the heat stress toolkit are the ways that we've been doing this. So we've been building and using the best evidence to target initiatives. We've been improving OHS knowledge practices through these tools. And we've been supporting workplace parties to fulfill their roles and responsibilities and making it easier for small business. And how better to do that than through these tools that are friendly and easily usable. So we can move to the next slide, Holly. Speaking of which, that large project was launched a year ago at our October session in 2023. And we have met or exceeded our targets, but it's not enough. We need your help reaching this very difficult target market. We are expanding the tool feasibility into other contaminants and other industries. New Brunswick has recently taken on the tool and is actually gifting Ontario a French version of the tool, which is very exciting. We've seen a surface mining version. We've seen Manitoba move on the tool. Nova Scotia is in discussions with us. So as Dr. Moody led out, we are not only helping Ontario, but we are moving across internationally and nationally, supporting these projects. And you're going to hear more from these folks in the sessions as you'll throughout November. So again, reminder, you're going to hear from our panel, but it is specifically geared toward the construction industry right now, where things are ever changing and where traditional exposure assessment strategies just are not so straightforward. Work sites changing rapidly, workers and companies moving between sites, tasks vary within shift, lack of available in-house exposure measurements, and the industry being made up of small employers, less than 10 employees. So the Silica tool can help fill that gap where traditional exposure and control strategies are lacking. Next slide, please, Holly. I wanted to also take the opportunity to share some of what our other system partners are up to, and you're going to hear from some of them. We hoped they could join us today, but due to scheduling, we're going to bring them on the tail end of our series. It'll keep you coming at the end of November. But the ministry hygiene campaigns include, a promotion of the Silica tool to construction workplaces. So again, the ministry hygienists will be performing proactive inspections to ensure compliance with Regulation 833 And our OEL tool can be helpful with this as well on our website. So take notice that that is happening within the province with a sub-focus of this promoting the silica tool in construction workplaces. And we were happy to have been able, this team that you're meeting shortly in the panel and who are spearheading our entire October event. They were able to demonstrate and showcase and provide the tool to over 100, Holly, you can put in the chat, I think, construction inspectors and hygienists so that they would be familiar with the tool to promote it in the workplaces. Next slide. The other initiative that the hygiene campaign is promoting through the ministry is they're going to be conducting proactive inspections about the WHMIS regulation. So the Federal Hazardous Products Regulation was amended in December 2022. And under that regulation, suppliers of hazardous products are required to provide safety data sheets and ensure that the containers of the products are properly labeled. So these amendments in the Hazardous Products Regulation included changes to hazard classification and additional required elements in the safety data sheet. So there's been a 3-year transition period for suppliers to comply. And during that time, workplaces will begin to receive these updated SDSs and labels for their hazardous products. So the purpose of the campaign is to ensure that employers are aware of the changes to the hazardous products regulation, and they're required to retrain workers on WHMIS where necessary. So that's been going on to support occupational illness prevention. And next slide, please, Holly. And Dr. Moody alluded also to the heat stress toolkit, which was another amazing project that stemmed out of the Occupational Illness Steering Committee, Prevention Steering Committee, and also updated the old OSHCO material. So all the system partners, the stakeholders, it started out, we consulted on the potential regulatory change and then created a toolkit to support that. We haven't seen the regulatory change, 121, thanks Holly. I knew it was a over 100 number, but I couldn't remember the details. So the toolkit has been really useful, and we get a lot of positive feedback. And again, it's an all system partnership. I really want to make a shout out to the Crosh team who helped, who were a major joint partner in this initiative, as well as the whole system. So the toolkit hopefully helps workers better understand the heat conditions, has a series of videos, a calculator, 3 new reference guides, an awareness guide, a physiological monitoring guide, and a prevention tools and strategies guide. There are promotional posters, infographics, and in multiple languages. And next slide. Hope I haven't gone over here. I will wrap it up just to say, stay tuned with us for the whole webinar series, as we will be hearing from U of T with the feasibility of a welding fume tool. We'll be hearing about exposure and control banding. We'll be hearing from a panel, including our own Dr. Kevin Hedges and Simon Smith, around the CSA respiratory standard and how it's advancing. And to wait no further, or without further ado, I did want to pass it on to our next speaker, Dr. Tracy Kirkham from the Occupational Cancer Research Center. And of course, I can't find her bio. I had it fit right with me. Bear with me 1 second as she pulls up, maybe as you pull up her slides. Holly, I will find it. Oh dear.
While you are finding it, Kimberly, this is Krista talking. I just want to say something I neglected to say at the start for all attendees to know. Near the end of the session, we will give you a link to a survey with an opportunity to provide feedback on today's session. As well, you will have the opportunity to input your email if you'd like to request a certificate of attendance for the session today.